So in this video, I'm gonna be talking about the part three of the traction and myofascial decompression physiology. The first question will be, in your own words, explain the impact of traction on the healing process for acute conditions. According to the book, traction, you will not want to do it when it comes for acute injuries, specifically like acute injuries, um, hypermobile vertebrae. You will not want to do that because it can be able to cause more damage than actually help out with the patient, according to what it says on the book on page 319. That's what it says, that you cannot be able to do traction on acute injuries. But I'll be talking about traction, how it impacts on the healing process. So the way that it impacts on the healing process, since you're kind of like causing that stretch, that decompression on the area, what it basically do is kind of like it elongates those muscles that you have injured, right? By causing that elongation in the area, what it does is kind of like increases blood. It helps out with an increase of blood flow. By having an increase of blood flow means that you will be able to provide more oxygen and nutrients into the injured area. By having more oxygen and nutrients in the injured area means that there are gonna be more white cells uh, in your area to be able to help out with the healing process, right? To be able to fight the dead cells and kind of like help out with that healing process a little bit faster by having an increase of blood flow and having those terms implemented, right? You will also be able to have an increase of chemical mediators such as leukotrienes, such as neutrophils, that will help out with that healing process too. Um, and then for the second question, in your own words, explain the impact of traction for pain management for conditions such as nerve impingement and disc herniation. So pain management uh, for the nerve impingement, right? What it basically does, you kind of like causing a decompression, right? You're decreasing that mechanical pressure that it has the nerves. By having that decompression on the nerves, you kind of like stretching them out. By having that, you help out with decrease whatever type of issue is having according to the nerves. Could it be pain? Could it be numbness or tingling? Right? Could it be any of those? But having that stretching out those nerves, it kind of like helps out uh, with that pain management to be able to go away, because the pain you have in like in a specific area, because of the limited area that the pain can be able to follow through. By having that elongation on the nerves, it means that that pain that is located can be able to spread out a little bit more. uh, what I mean by that is kind of like it will not stay on the specific area, and it will help out decrease that pain that you have there because of having a decrease of mechanical pressure. And then when it comes for the disc herniation, for the pain management, like I said, you kind of like stretching out that area, right? When it comes for the vertebrae, you kind of like decompressing the pressure also that it has. You kind of like pushing, separating them. By causing that separation, disc herniation will be like the nucleus in the middle of each vertebrae. It's kind of like tilted, either like anteriorly or posteriorly. By having traction, what do? It's kind of like you stretch out that vertebrae. That nucleus will be placed back in the middle, in the center of each vertebrae. That will be able to help out and be able to place that disc herniation back into place to be able to decrease the pain management according to disc herniation. When it comes for that, you kind of like want to do a different type of traction, which will be sustained, because intermittent, since you're gonna be having on and off time. Yes, having an on and off time, you can be able to place that nucleus back into place. But at the same time, since it's not going to be stable there, it's just going to go right back out, either posteriorly or anteriorly. So you would like to do some sustained traction, that it will be traction for a longer period of time, right? To be able to help maintain that nucleus in the center of the vertebrae. And then in your own words, for the third question, in your own words, explain the impact of myofascial decompression on the healing process. What it does, myofascial decompression on the healing process, which will be cuppings, by having an increase of blood flow. The way that you increase the blood flow with myofascial decompression, Myofascial decompression, what it does is the cuppings, right? What it does is separates that myofascial tissue and structure that you have in between the skin and the muscles. By having that stretch, it open up to be able to have a little bit. It open up to have more increase of blood flow. So it's kind of like really similar when it comes to traction. The process of it, not exactly how it works, because cuppings you provide that separation of the myofascial tissue. By having that separation, you increase blood flow. By having an increase of blood flow, you will be having more oxygen and nutrients into the area to be able to help out and provide more white cells in your area to be able to help with the healing process. And also, you will have an increase of chemical mediator such as neutrophils and leukotrienes. Those type of chemical mediators will be able to help out provide a little bit more when it comes to the healing process also. And then for the last question, in your own words, explain the impact of myofascial decompression on pain. Uh, when it comes for pain, myofascial decompression, what it does, when it comes for like the gait control, what it does, when you have that cupping over there, that is sucking that skin, that is separating that myofascial layer. What it basically does through the gait control, it releases endorphins. By having a release of endorphin, it provides like a blockage for the A delta and C fibers, which are gonna be the nociceptors. That's kind of like what it mainly thing does. It releases endorphins, having an increase of um, endorphins, which blocks the nociceptors are going to be the pain stimulus, A delta and C fibers. It provides like a blockage for that. So that's kind of like the way that myofascial decompression impacts on pain by having that blockage in there. And then once you take the cupping out, it releases more of that endorphins into the area uh, to be able to help out with the pain management for myofascial decompression.